Welcoming a new baby is supposed to be this time of pure, unfiltered joy. But what happens when it's not? Or when that joy is mixed up with a whole bunch of other feelings you just didn't see coming? Well, for so many new mothers, there's this really challenging, unspoken chapter to the story. And today, we're going to navigate that real landscape of maternal mental health, showing you that if you're struggling, you are so not alone.
And this is the question, isn't it? It's right at the heart of everything. We're all given this powerful script about what new motherhood should feel like. But what if your reality just doesn't match up? That gap, that disconnect, can feel incredibly lonely.
And this slide, wow, it just shows that gap perfectly, doesn't it? Over on one side, you've got the expectation, constant joy, that instant bond, feeling totally confident. And on the other side, well, that's the reality for so many of us. Low moods, anxiety, feeling completely and utterly overwhelmed. It's not just being a little tired, it can be this really profound sense of detachment. If that column on the right feels even a little bit familiar, I just want you to know you are in the right place.
And let's just let that sink in, because it's the most important message to hear right from the get-go. These feelings, they're not a sign that you failed. They are a common, shared part of the postpartum experience, and just acknowledging them, well, that's a huge sign of strength.
Okay, so how do we start to make sense of all this? The first and maybe the most powerful step is just giving it a name, putting a name to what you're actually experiencing. So let's dive in and look at some of the common signs. First up is postpartum depression. And this is so much more than what people call the baby blues. This is a sadness or an emptiness that just sticks around. It doesn't lift. It makes it hard to get through the day, hard to find joy in things. But the most important thing to know is that it is highly treatable.
And then there's postpartum anxiety. Now, this goes way beyond the normal nerves of having a new baby. This is when your thoughts just race. It's that constant looping worry that you just can't seem to turn off. Waking up over and over again just to check if the baby is breathing. That's what we're talking about. And it can be absolutely exhausting.
We also really need to talk about the birth itself, because this gets overlooked all the time. A difficult or traumatic labor can leave behind emotional wounds. You might find that your body is healed, but your mind is still trying to process everything that happened. And that's exactly what birth trauma recovery is for.
So just take a moment and look at this list. Are you struggling with your mood? Maybe finding it hard to feel that connection with your baby, feeling buried under guilt or overwhelm. If you find yourself nodding along to any of these, that's a pretty clear sign that reaching out for some support would be a really positive step.
Okay, so we've talked about the what. Now let's get into the how. What does getting support actually look like? What is this path to wellness? And how can it make a real, tangible difference?
The most important thing here is that this is not a one-size-fits-all kind of deal. It's all about a personalized approach. It often starts with therapy, things like CBT or ACT, which are just proven ways to help you process what you're feeling and build new coping skills. Then there's something called psychoeducation, which is really just about understanding the why. Learning about the massive hormonal shifts and brain changes that are happening in your body. It's fascinating, actually. Then you've got mind-body support, which gives you real practical tools for your day-to-day life, like mindfulness, to calm those racing thoughts. Sometimes it can even include family counseling to help you and your partner get on the same page. And finally, only if it's the right choice for you, there's psychiatric support with safe medication options that are always discussed with you and closely monitored.
All right. Even when you know help is out there, it is so natural to have questions or even fears that kind of hold you back. So let's just clear the air and tackle some of the most common ones head on.
This is a big one, a really big one. So many new moms are worried about medication, especially if they're breastfeeding. So is it some kind of requirement to get better?
The answer is a clear yes. You can absolutely get help without medication. For many women, talk therapy and learning new stress management skills are more than enough to start feeling better. The key thing to remember is that this is a partnership. Medication is always a conversation and a choice, never, ever a requirement.
Oh, this question. It really gets to the heart of the stigma, doesn't it? There's just so much pressure to be the perfect, happy new mom. And it can be terrifying to admit you're struggling. So, will you be judged for it?
Absolutely not, and that's a promise. The entire point of this kind of professional care is to create a safe space, a completely non-judgmental zone where you can be totally honest about what's going on and just begin to heal. What about the timing of it all? Is there a right time to reach out? Do you have to wait a certain number of weeks or months before it's okay to ask for help?
The answer here is beautifully simple. The right time is whenever you feel ready. It doesn't matter if it's days, weeks, or months after you've given birth. There is no wrong time. Support is there whenever you decide you need it.
And finally, a really practical and super important question, especially if you live in a close-knit community: confidentiality. Just how private is this whole process?
Yes, 100%. Professional care is bound by the strictest rules of confidentiality. Everything you share is protected, which means your privacy is the top priority. It's truly a safe and discreet space for you.
So now that we've cleared up some of those big questions, let's bring it all back to the most important part: just taking that first step. Because this is not a journey you should ever have to take by yourself.
Let this one really land. I mean it. It's the core message of everything we've talked about today. The feeling of isolation can be massive, but support is out there. You do not have to do this on your own.
And that's really the key takeaway here. Just recognizing and naming what you're feeling, that is a huge, powerful first step. And from there, professional support can give you the tools and the guidance to help you find your way back to balance and back to clarity.
So I want to leave you with one final thought. Forget about the whole staircase for a minute. Just think about one single step. What would your very first step toward feeling a little bit more like yourself again? What would that look like?